Hello everyone, welcome to the Medic World Study with Dr. Mahi. Today we are going to discuss the previous year questions of anatomy from AIIMS 2018. So let's start with the first question. The structure marked by the asterisk in the electron micrograph indicates. Here we have to see the image first, and in the image the structure which is marked with asterisk is the presynaptic secretory vesicles. So the answer to this question is option C, that is secretory vesicles. Next question. Inferior thyroid artery is a branch of which of the following? So we all know that inferior thyroid artery is a branch of thyrocervical trunk, which in turn is a branch of first part of the subclavian artery. So the answer to this question is option C, that is thyrocervical trunk. Next question. Neurovascular bundle is absent in which compartment of the leg? Answer to this question is option B, that is posterior superior superficial compartment of the leg, because it is deprived of any neurovascular bundle. So the answer is option B. Next question. A patient presents to you with inability to form words but can make noises. He also knows what he wants to say. What area of the brain has been damaged in this patient? So, as per the given clinical scenario, we can diagnose it as a case of Broca's aphasia. So, the answer to this question is option B, that is Broca's area is damaged in this case. Next question. Identify the wrongly marked structure in the diagram. Here in the diagram, we have to identify each of the structures first. A is the corpus callosum, A. B is the fornix, C is the pituitary gland, and D is the cerebellum. Let's see the options. A is corpus callosum, right. C is hypothalamus. No, it is the wrong one because it is the pituitary gland. So the answer is B. Let's see other options. B is fornix, right. D is cerebellum, right. Next question. Loss of flexion of the interphalangeal joint of the thumb after supracondylar fracture is due to the involvement of which nerve? So the answer to this question is D, that is anterior interosseous nerve. Anterior interosseous nerve damaged in supracondylar fracture leads to the loss of flexion at the interphalangeal joint of the thumb. Next question. Purkinje cells of cerebellum relay into. The Purkinje cells of cerebellum relay into the dentate nucleus, which is one of the deep cerebellar nuclei. So the answer is option C, that is dentate nucleus. Next question. Which of the following sensations is not perceived by the spinal nucleus of the trigeminal nerve? We all know that proprioception is perceived by the mesencephalic nucleus of trigeminal nerve and not by the spinal nucleus. So the answer is option D. Next question. The structure marked in the given image arises from the. Let's identify the structure first. Here the structure which is marked is the fornix and it arises from the hippocampus and ends in the mammillary body of hypothalamus. So the answer to this question is option B, that is hippocampus. Next question. Which of the following arteries does not supply the corresponding region of the dura mater? Let's see the options. Middle meningeal artery, anterior cranial fossa, right option. Accessory meningeal branch of maxillary artery, middle cranial fossa, correct. Meningeal branch of internal carotid artery, posterior cranial fossa. No, it is the wrong statement because it supplies the anterior cranial fossa. So the answer is option C. Let's see the last statement. Meningeal branch of anterior and posterior ethmoid artery supplies the anterior cranial fossa. It is the right statement. Next question. All of the following take part in the formation of wrist joint except we all know that scaphoid, triquetrum, and distal end of radius takes part in the formation of wrist joint, but distal end of ulna doesn't take part in the formation of wrist joint. So the answer to this question is option D, that is distal end of ulna. Which of the following nerves is not involved in olfaction? The hypoglossal nerve is the purely motor nerve, and so it is not involved in the olfaction. So the answer is option D, that is hypoglossal nerve. Next question. Which of the following is the most conspicuous sign of the breast cancer? The most conspicuous sign of breast cancer is PUT orange appearance. So the answer is A. Next question. Identify the cranial nerve that passes through the foramen marked in the image below. Here in the image, the foramen which is marked is the superior orbital fissure and the nerve which passes through it is the oculomotor nerve. So the answer is A, that is oculomotor nerve. Next question. Which of the following veins drain into brachiocephalic vein? The left superior intercostal vein drains into the left brachiocephalic vein. So the answer is option D, that is left superior intercostal vein. Next question. What is the main action of the muscle marked below? Here in the image, the muscle which is marked is the temporalis, and the main action of temporalis is the elevation of mandible. So answer is option A, that is elevation. Next question. Ligamentum flavum has high levels of. So the answer to this question is option D, that is elastin fibers, because ligamentum flavum has high levels of elastin fibers. Now the next question. Which muscle is not involved in inversion of foot? Peroneus longus muscle is not involved in inversion of foot because it causes the eversion and plantar flexion. So the answer is option C, that is peroneus longus. Now the next question. Which of the following is normally seen in lumbar spine? We all know that normally lumbar spine shows lordosis, lumbar lordosis. So the answer to this question is option C, that is lordosis. Next question. Type 1 collagen is not seen in. We all know that cartilage contains type 2 collagen. The only cartilage which contains the type 1 collagen is the fibrocartilage. So the answer to this question is option D, that is elastic cartilage, because it contains type 2 collagen and not type 1 collagen. Now the next question. The correct pair of lymph node level in the neck and anatomical boundaries amongst the following are. We have to identify the correct pair here. Let's see the options. Level 3 is cricoid to clavicle. No. Level 4 is hyoid to cricoid. No. Level 5, base of skull to cricoid. No. Level 6, hyoid to clavicle. This is the correct option. Now, the next question. Meissner's corpuscles are present in. The answer to this question is papillary dermis, because Meissner's corpuscles are present in papillary dermis.